Today, I would like to talk about the correlations between mammographic density, analysis of background echo texture on ABUS according to various criteria, and the factors affecting the background echo texture on ABUS. Breast density, a relative value for the amount of fibroglandular tissue, can be affected by various genetic, hormonal, and environmental factors. Mammographically dense breasts have been correlated with a breast cancer risk 2 to 6 times of fatty breasts. A dense breast makes breast cancer detection more difficult at mammography and thus increases the risk of interval cancer between mammographic screening tests. On background ultrasound, the wide normal variability in tissue composition can also be observed just as seen on mammography. According to the BIRADS, background echo texture can be categorized as homogeneous or heterogeneous. Just as increasing breast density diminishes the sensitivity of mammography in detection of small masses, heterogeneous background echo texture of the breast, characterized by multiple areas of increased or decreased parenchymal echogenicity, may affect the sensitivity of breast ultrasound for lesion detection. Therefore, it would be important to indicate the background echo texture in an ultrasound report, such as in a mammographic report. Although handheld ultrasound is used widely in practice, it has the inherent drawbacks of operator dependence and lack of reproducibility. Static ultrasound images selected by investigators may not represent the background echo texture of the whole breast. However, automated breast ultrasound, ABUS, is a three-dimensional ultrasound imaging system that is able to scan the whole breast automatically and has the advantages of reproducibility and reduced operator dependence compared to handheld ultrasound. ABUS can provide true volumetric imaging data for background echo texture analysis and would be more objective and reproducible than handheld ultrasound. Therefore, the purpose of our study was to analyze the background echo texture on ABUS in correlation with mammographic breast density and to find the factors affecting the background echo texture on ABUS, including mammographic breast density. Between January 2011 and July 2011, 521 consecutive women underwent bilateral mammography and ABUS for the diagnostic setting or the screening setting at our institution. We excluded women who did not have greater than 1 week for the time interval between mammography and ABUS, N equals 21, had masses occupying almost the entire breast that were too large to analyze breast density on mammography or ABUS, N equals 2, or had too poor quality of ABUS images to evaluate the echo texture of fibroglandular tissue owing to insufficient compression, N equals 2. A total of 496 women were enrolled in this study. Mammography examination in 2 standard imaging planes were performed on a full-field digital mammography unit. All ABUS examinations were carried out using an Akusan S2000TM ABUS by a single technologist with at least 3 years of experience in operating ABUS. The slice thickness was set at 1 millimeter without overlap. Transverse, sagittal, and coronal planes for each breast were available. 3 radiologists who specialized in breast imaging and had 3 to 17 years of experience in interpreting mammography and breast ultrasound independently reviewed the image and were blind to clinical information and prevalence of density in the patient's breasts. The radiologists independently assess each mammography and ABUS image using the 5th edition of BIRADS and the modified background echotexture classification. Each mammography was assessed for breast density according to the 5th edition of the BI-RADS breast density categories. According to the BI-RADS lexicon, the background echotexture are classified as homogeneous background echotexture fat, homogeneous background echotexture fibroglandular, and heterogeneous background echotexture. Kim et al. Was classified as homogeneous background echotexture, mild heterogeneous background echotexture, moderate heterogeneous background echotexture, and marked heterogeneous background echotexture according to the proportion of the breast occupied by the fibroglandular tissue. We assess background echotexture on ABUS according to this classification, and we call this method a modified classification of background echotexture. 13, no slide. 14. After review of patient records, we compiled patient aids, body mass index, familial history of breast cancer, previous use of contraceptives, previous use of hormone therapy, menopausal status, and parity. Agreement on the mammographic density and the background echotexture on ABUS among radiologists was assessed using kappa statistics, Spearman's correlation test R, and Crucial-Wallace tests were used to determine the strength of the relationships between the modified classification for the background echotexture on ABUS and mammographic breast density. Univariate and multinomial logistic regression analysis were used to find the factors affecting the background echotexture on ABUS. The inner observer agreement values for all the background echotexture assessments indicated that there was substantial agreement among the radiologists. Regarding the correlation between background echotexture based on BI-RADS and mammographic breast density, or the background echotexture based on modified classification was scored from 1 to 4 according to grading as follows. And BI-RADS density was scored from 1 to 4 according to the categories as follows. And then, comparing the mean values for scoring of modified classification and mammographic breast density according to each background echotexture based on BI-RADS, there was a significantly higher mean value of homogeneous fibroglandular and heterogeneous BE compared with that of homogeneous fat BE, according to mammographic breast density and the background echotexture based on modified classification. Therefore, it is expected that modified classification and MG density will have a positive correlation with the background echotexture based on BI-RADS. Regarding the relationship between the background echotexture based on modified classification and mammographic density, there was a moderately positive correlation, indicating that women with a higher mammographic density had more heterogeneous background echotextures. There were moderately positive correlations between background echotexture based on modified classification and mammographic breast density in pre- and post-menopausal women. In multinomial regression of background echotexture based on BI-RADS, younger age was associated with homogeneous background echotexture fibroglandular and heterogeneous background echotexture compared with homogeneous background echotexture fat. In multinomial regression of background echotexture based on modified classification, younger age was associated with mild, moderate, and marked heterogeneous background echotexture compared with homogeneous background echotexture. In multinomial regression of mammographic density based on BI-RADS, younger age was associated with category B, C, and D compared with category A. Inter-observer agreement of background echo texture based on both BI-RADS and modified classification was substantial. Background echo texture based on BI-RADS and modified classification on ABUS had a good correlation with mammographic density. More heterogeneous background echo texture based on BI-RADS and modified classification and denser breast on mammography were associated with younger age. Lower BMI was associated with denser breast on mammography. Thank you for your attention.